Therapy kind of showed up on the radar when I started to think about the fact that I have autism. And so I thought about how there are very few people provide cognitive behavioral therapies or motivational interviewing type approaches to autism. And so that's why I wanted to get into it, because I think that's a really underserved area, and especially in an area where there is a lack of access to providers just to begin with, to have a sort of really targeted approach to something that a lot of people don't do. So I enjoy being a therapist in this area because I get to work with schools, which means I get to see a lot of the children and families sort of dynamic. And I also get to work with adults, and I'm in a rural area where I'm working with working Americans, and I think those are the kinds of people I want to help, especially the kids and families of people with autism, because that's just such a pervasive issue. And there's kind of this divide between developmental services and mental health services that really shouldn't and doesn't exist, but we've created. And I get to do that here, is I get to address both those needs. So you come back to my office and we sit and I just ask you how things are going, and then we kind of go through some paperwork and we talk. It's kind of an awkward first meeting because I'm learning a whole bunch about you and you've never met me. And so I think hopefully by the end of that meeting you feel comfortable, and then the objectives are ways we reach your goals. And then we kind of establish, how do we know when this is done? And the how do we know this is done is really important, because we start at the very end at the beginning and we kind of work our way forward. Cheese is my favorite thing about Wisconsin.